Good evening, good afternoon, and good morning. This is the 1419th, 80th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. ARPITA CHATTERJee. We welcome all to the session. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy was formed at the time of COVID by a group of homeopathic lovers, and homeopathy students and doctors joined along with them. And we have doctors from and eminent personalities from 65 countries have presented different papers on this forum. And today, our guest is Dr. ARPITA CHATTERJee, and doctor has completed MD homeopathy, then PhD. She's a PhD scholar as well as CCH CCP MHA London FM. These are the qualifications for her. She is the head of HOD and associate professor, Department of Pathology, Pearl University, Gujarat, and is a guest lecturer at prestigious MSU Psychology Department, ITM SLCS, University Vadodara, and Sigma University. She is the chief physician at Healing Center at Gujarat, and she is the founder of NGO World Healing Society Foundation, have been awarded the Face of the Year of Women 2023 for social work and homeopathy by Fox India Media. She is the speaker for Scientific Committee, Aisha Best Teacher Award in 2021 by Pearl University, have featured in numerous TV, newspaper, article, and social media pages. That means that she is full of uh, 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 contents, and she always want to promote homeopathy by all means, utilizing all opportunity that comes on her way. And today, very important subject is being discussed here, understanding the psychology of patients with the general anxiety disorder and its homeopathic approach. So we all know that our homeopathic system has a lot of medicines for anxiety disorders and particularly psychological problems. So we can proudly welcome our guest of the day, Dr. ARPITA, along with the our friends and doctors joined in the session. Welcome all to the session. Yes, Dr. ARPITA, you can begin the session. Yes. We can't hear you. Please unmute.
Am I audible now?
Yes, yes, now audible, now audible.
Thank you so much, sir, for the introduction and for welcoming me in such a wonderful way. I'm very much privileged to be here today. As itself, you first of all, only you said that this is a very important global thing which we need to understand, because as homeopath, we have much scope in this particular field when it comes to general anxiety disorder. So my topic is understanding the psychology of patients with general anxiety disorder and its homeopathic approach. I would like to also present the PPT. So I just want to share it. If it's okay with everyone. Yes, sir. Is it visible, sir?
Yes, yes, yes. Right.
All right. Because of the technical issue, I won't be visible, but my PPT will be visible to everybody. Is it okay?
It's okay. It's okay.
Yeah.
You
Uh,
can, if you can enlarge a little more, that's good.
all right, so I'll try to. Is it okay now?
Oh, okay, but the sign. Okay, now it is good.
All right. So, understanding the psychology of patient with general anxiety disorder and its homeopathic approach. So, what is actually general anxiety disorder and how do we approach it with homeopathy? This is the basic topic today. So, we would be taking into consideration the introduction. What is the aim and objective of this entire session? The pathophysiology of it, the diagnostic parameters, understanding the temperament, psychological analysis, and homeopathic approach. So this would be the entire thing which we would be taking into consideration. Is the PPT available to, is visible to everybody? Is it okay?
Yes, we can see, but since it is being from phone, it is smaller in size.
Yes, this is a technical issue that I am having right now.
No, no problem. You may continue with the presentation.
Yes, yes. So what is general anxiety disorder basically? So according to DSM-5, the general anxiety disorder has been actually considered as a disease condition or a disorder in which a person has anxiety, and that anxiety is continuous, that is thought, and that there is no control of the patient on this excessive thoughts and worrying nature. This is the basic issue which the client or the patient suffer from. The problem is the patient cannot control its own worries, its own anxieties, and the fears. And this goes on accumulating, and then the patient's try also gets certain problem on its physical aspects. Although that would be in the later stages, but in the initial phase, there would be 6 major symptoms which will be seen in these patients. According to DSM-5, these main 6 features are: first would be restlessness. There would be a quite, edged up feeling as if he needs to do something or something will happen. There would be this restlessness, mental and physical both. Second, they will be easily fatigued, of course, because there's restlessness, mental and physical. So you can understand there will be this fatigued. They will be fatigued all this time. Then the third thing would be there would be a difficulty in concentrating on something, or sometimes the other thing would be they would completely go blank. They would be unable to think, understand anything. The third would be irritability. This is one of the important symptoms in GAD. The other would be there would be soreness of muscle. Now that is again understood because of the anxiety, restlessness, and feeling and not able to concentrate, and all this thing together will lead to, and then irritability will lead to this muscle tension and soreness. And the last thing would be sleep disturbances, which could be in the form of either sleeping too much or not able to sleep at all. So this is the main 6 symptoms which would be seen in a patient. But for diagnosis, we need to only consider any 3 of it. I'll also tell you how to go about the diagnosis, and it is very easy if we as physicians and we as normal general public understand this. Why it is important is that globally it is seen that 4% of the global population is suffering from these problems. And the major issue is, of all the patients, if there is a general anxiety patient, only 1% comes out of 4 for treatment because of the social stigma attached to the issue. So this becomes a very big health issue for WHO as well. So what is the pathophysiology? See, as physicians, as logical individuals, and with advancements of science, we need to understand what is happening inside this mind, or what is happening inside the body of a person, which is leading to this constant thought and worry. Why the person is unable to take control of its own thought. So as far as the science of today, advanced medical science is concerned, the exact phenomena or the exact reason is yet unknown. But what is being understood is that there is a constant stress in the patient, which leads to the activation of amygdala, Now, amygdala, if you see, amygdala is a part of the brain which is responsible for emotion, memory, and for also taking into consideration the fear aspect. It is said that whenever we are in fear, the amygdala gets activated. Now, this is a very primitive brain of ours, because if you see, the brain has a primitive part and a very new part. The new part makes us human, like we are able to think, have cognitive ability, and everything. But amygdala is a very primitive part of our brain, which is to make sure that the species survives. And for survival, of course, one needs to understand where to fight and where to fight, means where he has to fight for the survival and where the person has to, run away from the situation. So in that case, the amygdala has a very important role to play, and that's why it is also associated with the memory and understanding, emotions as well. So it is said that these people have a very activated amygdala, and as a reason of it automatically activates their autonomous nervous systems, especially the norepinephrine. Now, what happens is that because of this, the stress activators get activated. The neural pathways get activated, especially noradrenergic and serotonergic neurotransmitter system gets activated. As a result of this, the body of this patient is always in this stress. But this stress is nothing like physical stress. The patient cannot run from the situation, and neither can the patient fight with the situation. In earlier days, when we were not living in cities, or when we were, let's say we go back 300, 400, or maybe when we were having a nomadic lifestyle, in those days, it was much easier. The stress was like either there was a tiger coming, so we would try to, take a fright, and we will run. And if there's a possibility to give a fight to the tiger, we would do it. But when it comes to today's scenario, that's not the possibility. It's more of a mental stress related to job, related to relationship, related to social anxiety, etc., etc., etc. So in that case, it becomes very difficult to actually, deal with the situation. And in this patient, particularly in these patients, this stress just keeps on, accumulating. So it is seen in such patients that they have lower levels of serotonin and higher level of noradrenergic neurotransmitters. Now, serotonin is actually the one which makes you feel happy. You feel happy, serotonin is released. Like, for example, when you hug somebody. But the noradrenergic is mostly for survival instinct of us. It makes us active, it makes us awake, it makes us alert. So what happens, it is seen that these people, they have this imbalance. The serotonins are low, the serotonin are low, and the noradrenergic neural transmitters are high. So this is the reason why in allopathy they use the serotonin reuptake inhibitors as medicines, or they are using serotonin norepinephrine reuptake inhibitors as medicines. So I hope we have understood the pathophysiology of it. Now, going forward, so what is the aim here? Are we really wanting to understand only the pathophysiology of it? No. We're trying to understand the anxious mind in terms of both the modern science and how homeopathy can also be a part of this modern science and can help patients come out of this disorder. And to be very honest, homeopathy has a wonderful role to play here. We will see as we go forward. So, as I said, the diagnostic parameters for this anxiety disorder are there. Out of 6, there should be 3 of the symptoms present. Now, what are those 6 symptoms? The 6 symptoms are, the first one is feeling excessive anxiety and worry. Restlessness, second. Irritability, third. Fatigue, fourth. Impaired concentration, fifth. Soreness and muscle ache. With that, difficulty in sleeping. So it's actually 6, But here, if you see the figures, there are 7. Don't worry. Actually, they have taken the restlessness and excessive worrying together. So it's like having fatigue, excessive anxiety, worry, and restlessness, irritability, disturbed sleeping, increased muscle soreness, or impaired concentration. Now, out of these 6, only 3 has to be present in the patient. But before we go for the analysis, the anxiety disorder is very similar to the panic disorders, and also it is very similar to the disorders like OCDs and to the disorders like social phobias and social anxieties. Now, how do we differentiate those? Now, when we have to differentiate general anxiety with OCD and depression, in case of OCD, we need to understand one thing. In case of OCD, the patient will continuously have repetitive, unwanted, intrusive thoughts, meaning the patient will continuously have repetitively same kind of thoughts, and those thoughts have nothing to do with their routine or their activities. This could be an image, this could be a simple thought or some person, something with which they will be very obsessed. And with that, there would be a repetitive, ritualistic behavior, and they would be not able to control themselves. They will go on doing it. You might see, for example, some people have this tendency of washing their hands repeatedly. So many of you might have seen people around you, or many of the doctors might have seen such patients who have this tendency of washing their hands continuously, on and off, on and off, on and off. So this is a ritualistic behavior in which the patient is compelled to do it. No control over their own behavior. So that's OCD. But when it comes to general anxiety disorder, here the thought and the worries have something to do with their daily routine or the activities. It's nothing that they are thinking out of the blues. It is something which is related to their affairs with their things which is going around. But the thing is, they are unable to stop the thoughts, and it is causing a lot of irritability, difficulty to concentrate, and all the other symptoms. Whereas when it comes to the major depressive disorder, that is depression, here there will be low mood. The foremost thing here, the patient will have a very depressed mood. The patient will not be very cheerful. Or sometimes the low mood association is related to some things in the past. Normally, it is related to some incidents of the past. And the question the patient will always have is, why did it happen? Why did I do this? I shouldn't have done that. So these are the questions which would be going on in a mind of a patient who is depressed. But when it comes to GAD, general anxiety disorder, here the anxiety will be more prominent. The person is more alert, more thought, and thinking. And the low mood would be secondary to the anxiety. And these people are having anxiety mostly related to what will happen if. So most of the time it is related to the future consequences, like what if that happened? What if I don't appear for the exam? What if I fail? What if some catastrophic event happens, etc. And in depression, there would be this associated symptoms of hopelessness, suicidal thoughts, which will be very prominent. But in case of GAD, here it will be more related to muscle tension, palpitation. So there will be certain physical symptoms which we'll be able to see here, like soreness of muscles and not able to sleep properly. But that's there in depression as well. But when it comes to general anxiety disorder, here the soreness of the muscle and fatigue is more prominent. Now, as I told you about we have already discussed about obsessive compulsive disorder and about mood disorder. Now, coming to the other one is social anxiety disorder. Now, in social anxiety and the panic attack, now these are two different things. These are again caused by anxiety. But the difference between panic attack, social anxiety disorder, and GAD is that the generalized anxiety disorder is mostly generalized. The people with GAD will have the worrying aspect would be related to a generalized thing. But when it comes to social anxiety disorder, this will be more in terms of performance in front of people or in parties, events, or getting in touch with people, public will be these people mostly will not be very comfortable with people around. So that's the basic, and they will have this anxiety attacks only when they are in that particular environment, like parties or some gatherings, etc. But in general anxiety disorder, it has got nothing to do with such places. It might get triggered there also. It might get triggered even at their home just by thinking, because the thought process is continuously going on. It is not triggered only by the social environment. But in social anxiety disorder, the gathering is the exciting factor. And when it comes to the panic attack, in panic attack, it is a little different. Here, the panic attack is triggered suddenly. All of a sudden, there will be this attack, and the patient will have trembling, sweating, palpitation, and that is again specific to certain stimuli, to certain thing. Again, general anxiety disorder is more about the generalized thought. It's about the way of looking at things. And if we understand till now, if you have understood one thing, these people have, general anxiety people have a little pessimistic way of looking at things. Whereas when it comes to panic attack, these people get the attack only when they are in that particular area or space. For example, people having panic attack when they go for a very close surface of area, or where there are too much of people around, too many things around, or maybe they have some childhood trauma which can lead, or maybe they have met with a traumatic attack episode, and all of a sudden, due to certain emotional triggering factor, it got stimulated, and the patient got this attack. So it is more related to some kind of stimuli. Whereas in GAD, it's not so. It's more about the events which is happening now, or maybe in the future, and more about the way the patient thinks, related to the way of the thoughts. So general anxiety disorder. All right. So now, even if I told you everything, even if you have understood it according to DSM, still people might have difficulty in analyzing a case. So in that case, very simple scale is there. You all can use it, and it's a self-questionnaire where a patient can be given this questionnaire. They can answer it themselves. Even if the doctor wants, they can do it in the clinic itself. And in this scale, it gives us a very clear-cut idea whether this person is suffering from general anxiety disorder or something else. So this is a very simple, and it doesn't take much time. Within 5 to 10 minutes, this scale would be done. So there are 7 questions which is being asked to the patient, and according to their severity of the symptoms present, they have to give ratings to it. So in this general anxiety 7 scale, what we have is that the patient who had come to you should have these problems for the last 2 weeks. So this is the first criteria. They should have this problem for the last 2 weeks. And this should include the following 7 problems. So what are the problems? First is feeling of anxious, nervous, or on edge. Now, if they don't feel it, then the marks is 0, not at all. Several days in a week, then 1. If more than half the days, say for example, they for last 7, 8 days, half the week, or maybe the half day. In the morning they have these thoughts, in the night they're okay. So if it is the problem, if that is the case, then in that case it's 2, we give marks 2. And nearly every day the patient, irrespective of where it is, wherever he is or she is having this feeling, then the marks is 3. So this is the thing. If any of the 7 symptoms, if they do not feel it, it's 0. If in a 2 weeks time, if they have felt it several days, then it's 1. If more than half the days, like if say for 15 days they have felt it for last 7 to 8 days, then you have to give 2. And nearly every day, then it's 3. So first is feeling anxious. Second is not being able to stop or control worrying. Third is worrying too much about different things. Fourth, trouble relaxing. Fifth, being very restless and hard to sit still. Sixth, being easily annoyed or irritable. And the last one is being afraid as if something awful might happen. So once you have asked all the 7 questions and the patient has given his answer, now we have to do the simple calculation. So like, for example, in the question number 1, he gave 2. He scored 2. The patient scored 2. In second question, he scored 3. And then in third question, 2. Fourth question, 3. So that way you have to calculate. Now, how do we come to the conclusion? So this is the answer key. So the score should be, if it is, so you can see, I hope everyone can see this. Are you able to see this answer key? Can I get an answer? Yes? All right.
We can see it.
Yes, yes. So this is the answer key. If you see the score, the scores are 0 to 4, no risk. So we do not have to do any kind of intervention. 5 to 9, it is mild. So we need to take a follow-up of the patient. And in 4 weeks' time, we see if there is some improvement. We keep talking to the patient, give them counseling. And in that thing, we again need not give any kind of medication. 10 to 14 and 15 plus, that is moderate. 10 to 14 is moderate. And if it is the score is above 15, then it is severe. In these two cases, moderate and severe, we need to do further evaluation by doing a complete case study of the patient, starting from its, like the one we do in homeopathic practices. So we need to do the complete casing of the patient, do a therapy, a counseling therapy, and with that, if possible, homeopathic medicine should be given. Now, this is what I understand and you understand. But if it is the same thing given in organon, we will again see and we will understand, yes, it is given, and we will see that how the modern science and homeopathy comes together here. And when it comes to the severe thing, of course, we need to take care of the patient. First, we need to take the follow-up, do the entire case taking, then reevaluate the case, do psychotherapy and pharmacotherapy, meaning medicines. All right. So this is about how to go with the scale. Now, this is the entire understanding of what is. So with this, we understood what is general anxiety disorder. How do we diagnose the case? What are the differential diagnoses? And how do we do it? And before we, come to the concluding part of the modern science, before entering the science of homeopathy, let's just understand the last thing. What do they have to say about the psychology of these patients? So what they are trying to say here is that these people have 2 things common. That is, they have behavioral inhibition and harm avoidance. So if you understand it in terms of homeopathy, it's like the temperament of these people are such that they would try to avoid doing certain things, that is harm avoidance, or there will be some inhibition because they have fear, or because they withdraw themselves, either of the 2 things. First thing, they will have inhibition because they are very much anxious of the thing, and they have harm avoidance tendency, and because of which these patients will suffer from GAD. Now that's the understanding psychologically that why these people behave in this particular manner. It's because to avoid the harm, and secondly, the inhibition. They will not express themselves. The behavior will be very much withdrawn, or it would be out of distress or fear. So now this is what is the modern understanding. Now what about homeopathy? Now what do we do in homeopathic science? So let's first understand the classification. Let's classify the disease, how GAD is classified as per Organon. What is the management? What is the miasm, medicine, and the dosage? So let's start. Now, according to Dr. Henneman, according to 6th edition of Organon of Medicine, it is in aphorism number 216, the mental disease appearing with the decline of, so I'll just enumerate few aphorisms. What I would want from all of you is that once I have talked about all the 4 things, I would request all of you to make a guess. Like, for example, the question is, I'll say the question first. General anxiety disorder, it belongs to which of the 4 aphorisms? I'll start reading the aphorisms. So kindly listen to it and kindly send the answer on the chat box. So that way we both will be interacting with each other. I hope it is okay with everyone. All right. So the question, so first the question, let's listen to the question. The question is, general anxiety disorder, according to Organon of Medicine, in which particular aphorism of mental diseases does it belong to? So here in 2006, aphorism 216, Dr. Henneman says mental diseases appearing with the decline of corporal diseases. This is aphorism 216. All right. Aphorism 221 says mental diseases appearing suddenly as an acute disease in the patient ordinary calm state, which is caused by pride, vexation, the abuse of spirituous liquor, etc. The third, aphorism 224 says mental diseases of doubtful origin. The last one, aphorism 225 says mental diseases caused by prolonged emotional causes, which in time destroy the corporal health. That is 225. Now, please write down your answers, whether it is aphorism 216, aphorism 221, aphorism 224, or aphorism 225. I hope all of you will give the right answer. So if you have given the answer, and if your answer is aphorism 225, it's right. Because it says there are few emotional diseases which have not been developed out of corporeal diseases, but are in an inverse manner, arise and kept up by the emotional causes, as the body is slightly indisposed, such as by anxiety, worrying, vexation, and the frequent occurrence of great fear or fright. These kinds of emotional diseases in time often destroy the corporeal health to a great degree. So yes, this looks just like what we have classified as general anxiety disorder. Of course, this is what Dr. Henneman talked about. So what about the treatment plan? Did he have any plan for this kind of approaches? Yes, he did have. So about the management, he says, the emotional cause mentioned above serve as the exciters and maintainers, that is causa occasionalis of the disease process. If the disease is recent, as has not yet the corporal health much has not affected, the patient may recover into seemingly healthy state by psychical remedies or an appropriate diet and regime. So what he says is exactly what we read just a few slides back. If you remember, I'll just show you the slide again. So if you remember, I told you that according to them, the treatment has to be planned only and only when, so if you remember this, the intervention has to be planned only when it is above 10 to 14 score of 15 plus. And if you see in Organon also, he talks about the same. He said psychical remedies. Now, what is psychical remedies? Those are the remedies, meaning psychotherapy, counseling. This is what he is talking about. And proper diet and regime. Like we need to make them have a proper, understanding of perception, of perceiving things, of having a better regimen, diet. There are certain scientific articles which have shown that people suffering from general anxiety disorder tend to suffer more if they are taking coffee. See, so Dr. Henneman was far ahead in his time, and he knew what he was saying, which we right now are trying to understand with modern science. All right, so what about the medicine then? Or what and the miasm? So let's understand what is the miasm. I think all of you know it. In aphorism 210, Dr. Henneman talks about the miasm, which is aphorism 210. He's talking about it belongs to the soric miasm. Of course, it is soric in nature because here, as you read, there's more of a functional problem. It's not anything related with the physical body ailment. So it's more about the mental worries, thoughts, excessive worrying and thought. So it's, and the restlessness. So if you see, it's really belonging to the soric miasm. General anxiety is a disease condition in which we need to go for medicines which are having more of soric disposition. So I hope we are all clear up till here and we are on the same page as far as the miasm is concerned, as far as the therapy management is concerned. Now, let us just now understand, because we wanted to understand psychology with homeopathic understanding of GAD. So let's see this. So as per homeopathy, we take into consideration the temperament of a patient, because we understand as per the temperament of the patient, because this is something which is inborn. So we are born with certain temperamental characteristics. And according to that, there will be certain way of reacting to a certain situation, place, etc. So if you see this, in this case, we have 4 temperaments. We all are aware of it. If you are not, then I'll just make you recall. I know most of you are aware of it. So the 4 temperaments are, the first one is sanguineous, second is choleric temperament, third is phlegmatic, and the 4th one is melancholy. So what is the sanguineous temperament? These people are the, they are the ones who are cheerful, outgoing, fun-loving. They are the ones who, have this charm. They control people by the charm. They are the talkers. They are, they are the talkers. Like they can influence people. They know how to, make people like them. So they are those kind of people. When it comes to the choleric, they are more like, they have this leadership quality. They are the doers. They are very strong, driven, goal-oriented. They are controlled by fear and threat. And there's an anger element in them, which is very prominent. That's why the color red. And when we talk about the phlegmatic temperament, these are the people who are the watcher, like they keep a watch. And this is just a simple understanding. But these people are very, laid back, easy-go-lucky types, and they are relaxed, adaptable, flexible, and they tend to delay things. Whereas the melancholic people are very perfect. They are the thinkers. They are the one who wants things to be done orderly in a perfect, manner, and they want to be controlled by the. They are mostly controlled by their mood. They are little moody people. They are the thinkers. They are philosophers. They are good writers also, authors. So these are the people who are melancholic. So this is the basic understanding of us. And this basic understanding of temperament was given by Dr. not Dr. Henneman, but Hippocrates. So now, in today's time, is it applicable? Yes, of course it is. The same thing, if you want to understand, it is in today's psychology, it is they have given a terminology known as TICS, TICS. So a person who is chloric temperament, who is a doer, who is, a go achiever and everything like that, wants to achieve and are driven by work and everything, they are the dominant personality. So these people they have this dominance in them. So it stands for D. The sanguineous people are the influencer. They are the outgoing one, the optimistic one, high-spirited, lively, enthusiastic one. They are the people pleaser, right? Then the phlegmatic ones are classified as the steady people. They are patient, humble, tactful, evenly tempered, accommodating, very flexible, similar to what we call as phlegmatic temperament. And the last one is the melancholic temperament, which is here they have classified as conscientious. So they are very analytical, they are very reserved, they are precise, very private, they're systematic, and they want things to be perfect. So now, once you have understood this, now one more question for all of you. According to you, as per the temperament, what do you think? Who would be the one suffering from general anxiety disorder, according to your understanding as of now? So if you have understood, you can just write it down, whether it's the sanguineous temperament, chloric temperament, the melancholic one, the phlegmatic one. Who do you think is more prone to having general anxiety disorder? I will give you the answer in the last session, when the session ends. But before that, if you can just write the answers, we'll come to know later. So coming to now the remedies. Now, before I go to that answer of temperament, let's first understand the medicines. And because from this, I will make you also show you how that if you want to give medicines, you can give medicine through the constitutional understanding, the entire constitutional understanding. And also the other aspect is through temperamental analysis of a patient. So if you just do the temperamental analysis of a patient who is suffering from general anxiety disorder, you are able to catch that one particular thing in that patient and can correlate it with the medicine, you will be giving the right medicine. So with this, we will try to understand. Of course, there is no substitute for constitutional prescription. But if you want to understand how temperamental prescription can be done, you can do it as well. So coming to this medicines. Yeah, what I have taken here, I have just taken a few medicines only. So the few medicines are aconite, argenticum nitricum, arsenicum, calcarea, gelsemium, acacia, lycopodium, natrium, phosphorus, pulsatilla, and specia. So coming with this, so the here I have taken 4 criteria. I've just made a small, understanding. This is just the tip of the iceberg, friends. Just try to understand and get a little idea how you can just go about with the kind of problem which we are facing with the GAD patients, and how to just give a medicine and choose a medicine. This is just tip of the iceberg. I'll tell you. This is just for understanding and also for guiding you for the right selection. I hope this helps you. So this is my own understanding, and I've made this small presentation for all of you. So when it comes to medicine, the 3 medicines, aconite, arsenicum, and calcarea, have a very common thing. That is, they have fear. Now, the difference between the 3 of them and the fear is, in case of aconite, the fear of death is very strong, very, very strong. And there's a fear of impending death. All right. So you will see that aconite patient even predicts, they are clairvoyant. It is written in the Medica books. So yes, they have this very strong fear of death. When it comes to arsenicum, again, arsenic has this fear of death, but it is more related to the health. And, they have this thought that the disease is incurable. That's one thing very prominent in these people. When it comes to calcarea, they fear that they will break down from overexertion or from physical illness. So this is a very simple understanding of what fear is. Of course, we can go deeper into it later on someday, but this is just a basic understanding of fear. When it comes to aconite, it is more about the death. Of arsenic, it is more about the incurable disease, and in calcarea carb, it's more about the breakdown. The anxiety, when it comes to aconite, it is more about from sudden, grief, loss, and after effect of anxiety is also very much prominently seen in aconite. So after effect of anxiety, meaning after the sudden spell of anxiety, there would be a sudden loss of memory. There would be some spell of rage or hypersensitivity. activeness. When it comes to arsenicum, the anxiety is more about the future. What will happen? There's an apprehension about the future, the finances and the stability and the security. They are very much afraid of that. When it comes to calcarea carb, they are a little over controlling. They're anxious about change. They do not like change. They don't like to have changes, and they're again afraid of animals and stuff. Now, what is the physical expression of it? How will we express? How it will express? In aconite, it will be shortness of breath, strong palpitation, and flushing of face. In arsenic, there will be physical weakness but physically weak but mentally restlessness and insomnia. Whereas in calcarea carb, palpitation, sweating, extreme fatigue, chilly, craving for sweet, and laziness. What about the temperament aspect? And as far as DISC, what about this? If you see, in case of aconite, it is sanguineous influenza. Arsenic is melancholic conscientious. And when it comes to calcarea, it is phlegmatic and steady or steadiness. Now, let's see the other drugs. All right. So here we have taken 4 drugs. The 4 are gelsemium, lycopodium, silicea, arsenicum nitricum. So here they have the anxiety is due to the lack of confidence. In gelsemium, it is because of feeling of inadequateness, like they can't do it. There's this feeling, all right? In lycopodium, there's fear of failure because they take on responsibility. So they will have this fear of failure and they will try to cover it up by speaking loudly or speaking too much. When it comes to silicea, they have this fear of, public speaking. And also they would, because these people are very reserved kind of people. They're very shy. And there will be temporary loss of confidence. It's not like they are very, they lack the confidence, but because they do not like to interact, they don't like public speaking, they don't like to be in, getting attention of people. That's why they have this. In case of arsenicum nitricum, it is due to uncertainty. So they are more, because they are not certain what is going to happen. And they have this stage fright, fear before public speaking. But once they take the stage, they are very good. Now the timidness and shyness. If you see the shyness in gelsemium, it is, they want to be alone. They avoid public speaking and crowds. They are agoraphobic. As far as lycopodium is considered, they are more shy and timid in front of some authoritative figure. But if somebody is below them, they know how to dominate. But as far as silicea is concerned, they are more, they don't like, as I told, they don't like to speak to people. They don't like to get attention. They are not very open to new experiments, new things. So what they do is they get involved themselves into work and they are alone. And they are workaholic. Silicea are workaholic because they want to soothe the fear. Because they don't like public speaking, so they want to do it. They want to get out of that. And so they involve themselves with some kind of work. And in case of arsenicum nitricum, here you will see a different thing. They will be very hurried. Always some agitation is there, some hurriedness is there. So this is what they will have. So in spite of having anxiety, these are the things which you will see in this. What will be the physical expression of these? In gelsemium, they will be extremely lethargic, drowsy, and there will be a tendency to faint. As far as lycopodium is concerned, there will be craving for sweet with GIT upset causing blotting sensation. Silicea, here they will have difficulty in concentrating, fatigue, and headache. And as far as arsenicum nitricum is concerned, again the stomach upset is there, but there would be diarrhea and belching. But once they go on the stage, these people can take over. They do very well. What about the temperamental or the DISC classification of it? Of course, the gelsemium comes into the sanguineous temperament or the influencer. They are the influencer. The lycopodium are bilious or the chloric one. They are also, dominance, the D. The silicea ones are melancholic, conscientious, and the arsenicum nitricum is, of course, conscientious, melancholic. The last one, the last classification of the disease is pulsatilla, phosphorus, natronure, and ignatia. Now, in this again, there is anxiety. Pulsatilla is emotionally childlike, insecurity, childlike insecurity. They will. But in case of phosphorus, it is because they need approval from the social circle, from society, from their romantic partners. And they're full of imagination, these people are having intense, vivid fear and imagination. They're very open-hearted people. They make friends very easily, these people, phosphorus. But there is a constant desire to get approval, to get recognized by people. So this is one thing why they have this anxiety. But in case of natramure, it is some long-standing chronic grief or some stress or loneliness which has led to this anxiety. In spite of this, natramure patient would like to still be lonely. They don't like to be in company. They enjoy it. I will not say enjoy it, but yes, you do not like, because counseling aggravates. If you can't try to counsel them, or if you try to make them understand, they don't like it at all. On the other hand, ignatia again have something related to the grief and losing, again feeling, lonely. But in ignatia, they want to be consoled. They want to be, told that no, things will be fine. Don't worry. This is something the ignatia will crave for, but not natramure. Moody, yes. Here there is one thing. In pulsatilla, these people will be very moody, teary, and there will be this clinginess. So that will be their way of, expression. They will be always trying to cling to people, get some comfort from people. They are trying to, they will be weeping, and there will be teary eyes. So this is very common in pulsatilla when we see. But in case of phosphorus, they will be sympathetic. They will, they are moody in a way, like they are very sympathetic. These people, they sympathize on people, but sometimes they can go beyond just because they want to please people. So understand here, the sympathy is to make people approve them, so that people like them. People are charmed by them. So that's one of the reasons why they do it. And in natramure, they want to be alone, they cry alone, and they are withdrawn. So this is one thing in natramure, but in ignatia, there will be mood swings. So right now they are crying, and all of a sudden there will be this sudden blast of laughter, and the person will be laughing. So there will be this. What about the physical things? So as far as physical things are pulsatilla.
Hello, doctor. We can have one more session because it's a big subject you are talking, and we have just 7 minutes to finish the session. So
Yes,
I
sir.
think it is the time for discussion, and we can have a second part of the same in the third week of this month or last week of
So
this.
as you, if I'm given an opportunity, I would love to.
And definitely we can fix it on the first week or second week of the August. That's the way.
Yes.
Otherwise, it's a very important subject, and that's a good subject also. So we need time to go along. Okay. We can come up for discussion. We can start the discussion.
Yes.
Yes. Anyway, Dr. Arpita, really, you made a beautiful presentation. You covered almost every part of homeopathy, philosophy, then the temperaments and all those things. Because while treating every case, we need to look into all these aspects to find the right remedy, and the right remedy can definitely bring the fastest result. One can aim in homeopathy. We know that homeopathy is the only science where there will not be any side effect for after treatment. So while selecting or choosing the remedy, each and every homeopath need to go into the base, stick from the very basic to the all part. That means you have to look into the what is what, then what is, after knowing what is what, then how can we manage the case, this thing, what are the symptoms coming in the patient, and how the symptoms need to be converted into rubric, and then how one can choose after finding a simillimum, then whether you need to confirm it, whether it is the right remedy or not. By using all the technique, you will have to cover the mesmeric theory, you will have to cover the this temperament theory, and then you get the right remedy, and then thereafter you can think about the potency also. All those things will be very important as far as a homeopathic doctor to choose the right remedy. So always one need to look into the temperament as well as the miasm, and what Dr. Hahnemann has written some 250 years back are still relevant. There is no need of any change for our philosophy, but what we need is our attitude need to be changed, because we people think most of the homeopathic doctors nowadays think like that we need a protocol for this and that. Actually, the protocol was written by Dr. Hahnemann. That is individualization. That is what is the homeopathic protocol. And some people always say, what is your protocol for this remedy? Of course, there are some shortcuts for treatment, but frankly, it is not the right method. But we can choose any of these things when you find it a difficulty. That's the reason why in a very advanced, pathologically advanced cases, you go for pathological prescriptions and all kind of things. Anyway, only few minutes remaining. I'm not talking much anyway. Congratulations, and hope we can definitely have another session. Now we invite Dr. Ram Parisa to add his comments to this session. Since there is lack of time, we have no time.
Thank you. Thank you, Dr. Dhanesh ji, and congratulations, Dr. Arpita Madam.
Thank you, sir.
Very nice presentation, excellent session. Beautiful describe. Emotional, according to law of homeopathic science, main cause of disease, dynamic. Main cause of disease, Shora. Mother of all diseases, Shora. So, very beautiful describe anxiety and joy, fear, emotional diseases. Very, very thanks, Dr. Arpita Madam. Neurotransmitter, role of neurotransmitter. Very good. Role of neurotransmitter according to Sorik Niyaz.
Yes.
Thank you. Very, very thanks. Vishay Manorath according to Adhyat. According to Ramayana, Tulsidas Ram Charitra Manas. Manas Rog. मोह सकल व्याधिन कर मूला पिलते पुनि उजहि बहुतूला. और एंजाइटी ऐसे फियर, लोभ, ग्रीडी, एंगर, काम बात कप लोभ अपारा, क्रोध पित नित छाती जारा, तीनों भाई करही प्रीति उपदहि संपाद दुखदाई. ओनली फॉर एंजाइटी. विषय मनोरथ दुर्गम नाना. एक विषय पर चिंता करता है. विषय मनोरथ दुर्गम नाना, ते सब नाम सुन को जाना. ममता दादू कनु हरसाई, हरस विषाद गरा बहुताई. Very, very thanks, Ankita, Arpita Madam.
Thank you. Thank you,
Nice
Dr. Ram Parisa. And this is the time to wind up the session. I am very happy to invite Dr. Vaibhavi to say the vote of thanks to this week. Dr. Vaibhavi.
Arpita, again presentation.
Please.
IFPH.
Yes, sir.
Very good.
Yes.
Thank you so much. Whole team. Congratulations.
Thank you so much, sir. Sir, I want to just say one thing before this session ends. Just one thing I'll say. While I was studying psychology and pathology as a HOD, I'm seeing, sir, I get goosebumps every time I see organon of medicine coming to life with advanced science. And I'm not joking
Thank
here.
you. Thank
As
you.
a psychology student, when I used to go to the university, I used to feel that we already know it. Just the only problem we have, we don't know the terminology of today, or we cannot correlate that. That's the only problem we have.
Exactly. Anyway, it is the time to wind up the session. Before that, I shall announce that tomorrow we will have a session from Dr. Poonam Chabalani, and she will be talking about liver and biliary diseases and homeopathy. That will be the subject to be discussed. Thank you, Dr. Bai, thank you, Dr. Poon, ARPITA Chatterjee, to have a wonderful session in this evening. We are very happy to have such sessions in the coming editions of our webinars, and definitely you will be the one to be watched by everyone, because that kind of powerful presentation you have made in this forum. And definitely we will upload the sessions tomorrow itself, so that you can share it with your friends, and those who want to watch again and again can study the case, because these are the things that definitely is some of the study materials you can collect and keep it as a study material to bring the best out of you. And we hope that Dr. ARPITA will be a boom for homeopathy in the coming years. Thank you, Dr. ARPITA, once again, and thank you all for joining this session. And thank you all. Good night. We can see the same time tomorrow. It's over to Dr. P. Shaila to moderate the Malayalam session. Thank you.
Thank you, Dr. Dhanesh. Thank you, Dr. ARPITA. Thank you, Dr. Ram Pravesh Shah. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPHന്റെ ഇടതടവില്ലാതെ തുടർന്നു വരുന്ന വെബ് പരമ്പരയുടെ 1418 ദിവസം. ഇന്ന് മലയാളം സെഷനിൽ നമുക്ക് ഒരു ചർച്ചയാണ്. ചാന്ദിപുര വൈറസിനെ കുറിച്ചും അത് പരത്തുന്ന മസ്തിഷ്ക രോഗത്തിനെ കുറിച്ചുമുള്ള അതിന് ഹോമിയോപ്പതിക് ചികിത്സ, അതിന് എന്തൊക്കെ ഹോമിയോപ്പതി ചികിത്സ സാധ്യമായി ഉണ്ട് എന്നുള്ള വിഷയത്തിലെല്ലാം ചർച്ചയാണ്. അപ്പോൾ ഇന്നത്തെ ചർച്ചയിൽ പങ്കെടുക്കുന്നതിന് വേണ്ടി സൂം പ്ലാറ്റ്ഫോമിൽ എത്തിയിട്ടുള്ള എല്ലാ ബഹുമാന്യരായ ഡോക്ടേഴ്സിനെയും ഹോമിയോപ്പതി സ്നേഹികളെയും സ്റ്റുഡൻസിനെയും എല്ലാവരെയും ഞാൻ സന്തോഷപൂർവ്വം സ്വാഗതം ചെയ്യുന്നു. ഇന്നത്തെ ചർച്ച തുടങ്ങുന്നതിന് മുമ്പായി ഒരു നിമിഷം ഈശ്വര പ്രാർത്ഥന. നന്ദി. എന്തായാലും ഈ ഇന്നത്തെ ചർച്ചയുടെ ആമുഖമായി ഇന്നത്തെ വിഷയത്തിൽ ആമുഖമായി 2 വാക്ക് സംസാരിക്കുന്നതിനായി ഡോക്ടർ ധനേഷിനെ ക്ഷണിക്കുന്നു.
നന്ദി ശൈല ഡോക്ടറെ. നമ്മുടെ എന്തുകൊണ്ടാണ് ഇത് വളരെ പെട്ടെന്ന് നമ്മളിങ്ങനെ ഒരു വിഷയം ചർച്ചയ്ക്ക് എടുത്തെന്ന് വെച്ചാൽ, പെട്ടെന്ന് ഗുജറാത്തിൽ ഇങ്ങനെ ഒരു ചാന്ദിപുര വൈറസ് രോഗം വരികയും അതിന്റെ ഭാഗമായിട്ട് കുറച്ച് കുട്ടികൾ മരിക്കുകയും ചെയ്തതായിട്ട് റിപ്പോർട്ട് ചെയ്തു. മാധ്യമങ്ങളൊക്കെ അത് വലിയ പ്രാധാന്യത്തോടുകൂടി നോക്കിക്കൊണ്ടിരിക്കുകയാണ്. അപ്പൊ തീർച്ചയായും നേരത്തെ എന്തു വന്നാലും ആദ്യം വരുന്ന കേരളത്തിൽ എന്നുള്ള ഒരു രീതി മാറിക്കൊണ്ടിരിക്കുന്നു. ഇപ്പോഴത് ഗുജറാത്തിലോട്ട് പോയിരിക്കുന്നു. അപ്പൊ എന്തുകൊണ്ടാണ് ഇങ്ങനെ വരുന്നത്, എന്താണിത്, എങ്ങനെയാണ് ഇതിനെ നമുക്ക് നേരിടാൻ പറ്റുന്നത്, ഇതെല്ലാം നമ്മൾ ശ്രദ്ധിക്കപ്പെടേണ്ടതുണ്ട്. അപ്പൊ ചാന്ദിപുര വൈറസ് എന്ന് പറയുമ്പോൾ, വൈറസ് എന്ന് പറഞ്ഞാൽ തന്നെ നമുക്കറിയാം, ഈ വൈറസ് സസ്യകോശ ജീവികളിലെ ഏറ്റവും ചെറിയ ജീവിയാണ് വൈറസ്. നേരെ മറിച്ച് ബാക്ടീരിയ ആണെങ്കിൽ ജന്തുകോശ ജീവികളിലെ ഏറ്റവും ചെറുതാണ്. അപ്പം അതുകൊണ്ട് തന്നെ ഈ സസ്യകോശ ജീവികളായ ഈ വൈറസുകൾ നമ്മൾ മനുഷ്യന് ഗുണം ചെയ്യുന്നത് പോലെ തന്നെ ഒത്തിരി ദോഷങ്ങൾ ചെയ്യാറുണ്ട്. ഏറ്റവും കൂടുതൽ ദോഷമാണ് നമുക്ക് വരുത്തുന്നത്. ഇതിലേറ്റവും പ്രധാനമായിട്ട് പറയുകയാണെങ്കിൽ വൈറസുകളെല്ലാം തന്നെ അന്തരീക്ഷത്തിലൂടെ എയർബോൺ ഡിസീസുകളാണ് ഭൂരിഭാഗവും. എന്നാൽ മറ്റ് പല മാധ്യമങ്ങളിലൂടെയും അവർക്ക് മനുഷ്യരിലും അല്ലെങ്കിൽ മൃഗങ്ങളിൽ എത്തിച്ചേരാൻ പറ്റും. അപ്പൊ അതുകൊണ്ട് തന്നെ ഇത് ആ രീതിയിലുള്ള ഒരു മറ്റൊരു മാധ്യമത്തിലൂടെ മാത്രം പകർത്തുന്ന, അതായത് നമുക്കറിയാം ചിക്കൻ ഗുനിയ വന്നപ്പോഴറിയാം അത് കൊതുക് പകർത്തുന്ന, കൊതുക് ഈ രോഗമുള്ള ആളെ കടിച്ചിട്ട് അതേ കൊതുക് വേറൊരാളെ കടിക്കുമ്പോൾ അതിന്റെ ഭാഗമായിട്ട് ചിക്കൻ ഗുനിയ വരുന്നതായിട്ട് നമുക്കറിയാം. ഡെങ്കിപ്പനി ആണെങ്കിലും അതുപോലെ തന്നെ ഏഡിസ് ഈജിപ്തി എന്ന് പറയുന്ന കൊതുക് ഡെങ്കിപ്പനി ഉള്ള ഒരാളെ കടിച്ചിട്ട് അത് വന്ന് മറ്റൊരാളെ കടിക്കുമ്പോൾ അയാൾക്ക് ഡെങ്കിപ്പനി വരാം. ഇങ്ങനെയാണ് നമ്മൾ ഡെങ്കിപ്പനിയും ഒക്കെ മനസ്സിലാക്കിയിരുന്നത്. എന്നാൽ മറ്റു പല ജലദോഷപ്പനി, നമ്മൾ പറയും കോമൺ കോൾഡ് ആണ്, ഇതൊരു വൈറൽ ഡിസീസ് ആണ്. ഇത് സാധാരണഗതി ഡയറക്റ്റ് ആണ്, ഡ്രോപ്ലെറ്റ് ആണ്. നമ്മൾ തുമ്മുകയോ ചീറ്റുകയോ ചെയ്യുമ്പോൾ വിസർജ്യങ്ങൾ വന്നിട്ട് അങ്ങനെയാണ്. പക്ഷെ കോവിഡും യഥാർത്ഥത്തിൽ അങ്ങനെ തന്നെയാണ്. നമുക്കറിയാം ഇതൊരു വൈറൽ രോഗമായിരുന്നു, സാധാരണ ഒരു വൈറൽ രോഗത്തെ പോലെ തന്നെയാണ്. പക്ഷെ അത് കുറച്ച് വലിയ പർവ്വതീകരണം നടത്തി വലിയ ഭീകരനായിട്ട് പ്രഖ്യാപിക്കുകയും അതിന്റെ ഭാഗമായിട്ടുണ്ടായ ചില പ്രശ്നങ്ങൾ നമ്മൾ കാണുകയുണ്ടായി. എന്നാൽ ഇവിടെ ഈ ചാന്ദിപുര വൈറസ് എന്ന് പറയുമ്പോൾ അതും ഇനി ഭീകരനാക്കാനുള്ള സാധ്യതകൾ നമ്മുടെ മുന്നിൽ കാണുന്നുണ്ട്. അപ്പൊ അതുകൊണ്ട് അതിനെ ഒരു ഭീകരനായിട്ട് കാണണ്ട. സാധാരണഗതിയിൽ ഏത് അസുഖം വന്നാലും അത് പെട്ടെന്ന് ഗുണകരമാകുന്ന പോലെ പലർക്കും പെട്ടെന്ന് ദോഷം ഉണ്ടാക്കാറുമുണ്ട്. അതായത് പെട്ടെന്ന് വന്ന് പെട്ടെന്ന് കൂടി പെട്ടെന്ന് വഷളാകുന്ന രോഗത്തെയാണ് നമ്മൾ അക്യൂട്ട് ഡിസീസ് എന്ന് പറയുന്നത്. അപ്പൊ തീർച്ചയായും ഇതൊരു അക്യൂട്ട് കാറ്റഗറിയാണ്. വളരെ വേഗം മനുഷ്യരിൽ എത്തുകയും അതിന്റെ ഭാഗമായിട്ട് പെട്ടെന്ന് ഈ രോഗാണു ഒരു മനുഷ്യനിൽ നിന്ന് മറ്റൊരാളിലോട്ട് പകരാനുള്ള സാധ്യത കമ്പാരിറ്റീവ്ലി മറ്റ് ജലദോഷപ്പനി അല്ലെങ്കിൽ അതുപോലുള്ള പനികൾ, ഇൻഫ്ലുവൻസ ഒക്കെ ആയിട്ട് നോക്കുമ്പോൾ അത് അത്രയും കൂടുതലല്ല. കാരണം ഈ കൊതുക് അപ്പൊ നമുക്ക് എല്ലാവർക്കും അറിയാം, കൊതുക് സാധാരണ വളരുന്നത് ഏത് സമയത്താണ്? വേനലെല്ലാം കഴിഞ്ഞ് മഴ അങ്ങ് പെയ്ത് മഴ അങ്ങോട്ട് തുടങ്ങി വെള്ളം കെട്ടി തുടങ്ങുന്ന സമയത്താണ് കൊതുക് വളരാൻ തുടങ്ങുന്നത്. അപ്പൊ ആ ഒരു കാലാവസ്ഥയാണ് ഈ രോഗം ഉണ്ടാകുന്നതിന്റെ ഏറ്റവും സുപ്രധാനമായ കാലഘട്ടം. അപ്പൊ ആ ഒരു കാലഘട്ടത്തിൽ തന്നെയാണ് ഇവിടെ ഈ ഗുജറാത്തിലും മഴ തുടങ്ങി. അപ്പൊ അവിടെ മഴ തുടങ്ങി, വെള്ളക്കെട്ടുകൾ ഉണ്ടാകാൻ തുടങ്ങി. ഈ വെള്ളക്കെട്ടുകളിൽ ഉണ്ടായതിന് ശേഷം അതിന്റെ ഭാഗമായിട്ട് കൊതുകുകൾ വളരാൻ തുടങ്ങി. ഈ കൊതുകുകൾ അത് കൊതുകുകളിലൂടെയും നമുക്കറിയാം വെക്ടർ എന്ന് പറയുമ്പോൾ ഈ ഒരുതരം ഈച്ചകളും ഉണ്ടാകാം, അതുപോലെ ഇത് പകർന്നതായിട്ട് കാണുന്നുണ്ട്. എന്നാൽ ഈ എഡിസ് ജിപ്റ്റി എന്ന് പറയുന്ന കൊതുകും ഇത് പകർന്നതായിട്ട് കാണുന്നുണ്ട്. അപ്പൊ ഇത് രണ്ടും ഏകദേശം വെക്ടേഴ്സ് ആണ്. അപ്പൊ ഇതില് ഈ പറയുന്ന വൈറസ് എന്ന് പറയുന്ന ഒരു റാബ്ഡോ വൈബ്രിയ എന്ന ഫാമിലിയിൽ പെടുന്ന ഒരു വൈറസ് ആണ്. അതായത് നമുക്ക് ഈ ഇത് ഒരു റോഡ് ഷേപ്പിൽ ഇരിക്കുന്ന വൈറസ് ആണ്. അത് സാധാരണഗതി പറയുകയാണെങ്കിൽ ഇത് നമ്മളുടെ ഈ റാബിസ് പകർത്തുന്ന ആ ഒരു കാറ്റഗറിയിൽ പെടുന്ന വൈറസിന്റെ പോലെ തന്നെയുള്ള ശക്തിയുള്ള ഒരു വൈറസ് ആണ്. അപ്പൊ സ്വാഭാവികമായിട്ടും ഇതിന്റെ സാധാരണ രോഗലക്ഷണങ്ങൾ എന്തൊക്കെയാവാം? സാധാരണ നമുക്കറിയാം ഒരു പനി തന്നെയാണ്. ഏതിനും വളരെ പെട്ടെന്നുണ്ടാകുന്ന ഒരു പനിയായിരിക്കും. അതിനോടൊപ്പം ഭയങ്കര ഛർദിൽ വരാം. ഛർദിൽ വന്നു കഴിയുമ്പോൾ അതിനോടൊപ്പം വയറിളക്കം വരാം. അതിനോടൊപ്പം നമ്മൾ സ്വാഭാവികമായിട്ടും ഛർദിലും വയറിളക്കം വരുന്ന ഒരാൾക്ക് പെട്ടെന്ന് സീസേഴ്സ്, ചിലപ്പോൾ ഇങ്ങനെ കോച്ചിൽ പോലെ, ഹോട്ടൽ പോലെ, ഫിറ്റ്സ് പോലെയൊക്കെ വരാം. ഈ മൂന്ന് കാര്യങ്ങൾ ഒന്നിച്ച് വരുമ്പോൾ ഇതെല്ലാം വരാം. ഇതൊക്കെ വരാവുന്നതാണ്. പക്ഷെ നമ്മുടെ ഈ നിത്യേനയുള്ള കേസുകളിൽ നമ്മളിപ്പോൾ ഇതെല്ലാം കാണുന്നുണ്ട്. പക്ഷെ അത് ഇതാണോ ഇല്ലെന്ന് നമുക്ക് തിരിച്ചറിയാനായിട്ടില്ല, അല്ലെങ്കിൽ നമ്മളാരും അത് ടെസ്റ്റ് ചെയ്ത് ബോധ്യപ്പെടുത്താൻ ശ്രമിച്ചിട്ടില്ല. പക്ഷെ ഇത് വന്നതിന് ശേഷം പെട്ടെന്ന് ഈ ഗുരുതരമായ ഒരു അവസ്ഥയിലോട്ട് പോവുകയും അതിന്റെ ഭാഗമായിട്ട് ആള് പെട്ടെന്ന് തളർന്നു വീഴുകയും, അല്ലെങ്കിൽ ചിലപ്പോൾ കോച്ചിലുണ്ടായി എപ്പിലെപ്സി വരുന്ന പോലെ വരികയും, ചുഴലി വരുന്ന പോലെ വരികയും, അല്ലെങ്കിൽ അതിന്റെ ഭാഗമായിട്ട് കൈകാല് കോച്ചിപ്പിടുത്തവും ഒക്കെ വന്ന് ആള് പെട്ടെന്ന് കൊമാറ്റോസ് കണ്ടീഷൻ, അബോധാവസ്ഥയിലോട്ട് പോകുന്ന ഒരവസ്ഥയിലോട്ട് വരികയും ഒക്കെ ചെയ്യാം. അപ്പൊ ഇതൊക്കെയാണ് ഈ റാബ്ഡോ വൈറസിന്റെ സിംറ്റം. അപ്പൊ ഈ ഒരു അവസ്ഥ വരുമ്പോൾ പെട്ടെന്ന് എന്താണ് സംഭവിക്കുന്നത്? ഇത് നമ്മുടെ തലച്ചോറിനെ അഫക്ട് ചെയ്യാം, ബ്രെയിനെ അഫക്ട് ചെയ്യാം. ഈ ബ്രെയിനെ അഫക്ട് ചെയ്യുമ്പോഴാണ് എൻസഫലൈറ്റിസ് ഉണ്ടാകുന്നതും. അതിന്റെ ഭാഗമായിട്ട് ഈ എൻസഫലൈറ്റിസ് വന്നു കഴിയുമ്പോൾ സ്വാഭാവികമായിട്ടും ബ്രെയിൻ ഡാമേജ് ആയി. അപ്പൊ പെട്ടെന്ന് അതിന്റെ ഇൻഫെക്ഷൻ വളരെ വയലന്റ് ആയിട്ട് ബ്രെയിനെ അഫക്ട് ചെയ്യുമ്പോഴാണ് പെട്ടെന്ന് ഡെത്തിലോട്ട് പോകുന്നത്. അപ്പൊ യഥാർത്ഥത്തിൽ ഇതിനെ ഈ കറക്റ്റ് രോഗലക്ഷണങ്ങൾ മനസ്സിലാക്കി നമ്മൾ ചികിത്സിക്കുകയാണെങ്കിൽ നമുക്ക് ഇത് മാറ്റാൻ പറ്റും. അപ്പൊ ഇതിന്റെ ഈ അണുക്കൾ വളരുന്നത് ശരിക്കും എല്ലാവർക്കും അറിയാം, ഈ കൊതുകിന്റെ സലൈവറി ഗ്ലാൻഡിലാണ്. അവിടെയാണ് ഇത് അവിടുന്ന് വളർന്നിട്ടാണ് മറ്റു ഭാഗങ്ങളിൽ അത് എത്തിച്ചേരുന്നത്. തീർച്ചയായും നമ്മൾ ഇങ്ങനെയുള്ള കേസുകളിൽ വളരെ ശ്രദ്ധയോടുകൂടി തന്നെ ട്രീറ്റ് ചെയ്യേണ്ടതായിട്ടുണ്ട്. ഇപ്പൊ നമുക്ക് സ്വാഭാവികമായിട്ട് ഈ വർഷത്തെ ഇനി സാധാരണ ഒരു പനി തന്നെ തുടങ്ങുന്നത് മിക്കവാറും കേസുകളിലെല്ലാം തന്നെ തൊണ്ടവേദന എന്ന് പറയുന്നത് സെക്കൻഡറി ആയിട്ട് വരുന്നതായിട്ടാണ്. പക്ഷെ ഇപ്പൊ വരുന്ന ജലദോഷപ്പനി പോലും വരുന്നതിന് മുമ്പ് പെട്ടെന്ന് ഛർദ്ദിക്കുന്ന ഒരവസ്ഥ കാണുന്നുണ്ട്. ഛർദിൽ വന്നതിന് ശേഷം വയറിളക്കം വരുന്നുണ്ട്, അതിനുശേഷം പനിയും കാണുന്നുണ്ട്. അപ്പൊ ഇതെല്ലാം ഈ ഒരു കാറ്റഗറി അസുഖത്തിന്റെ ഭാഗമായിട്ടാവാം. സാധാരണ ഇൻഫ്ലുവൻസ വരുന്ന ഒരു സീസണിൽ വരുന്ന പനി പോലെ അല്ല ഇപ്പോഴത്തെ പനികൾക്ക് കാണുന്നത്. പക്ഷെ ഈ പറഞ്ഞ മേൽ ലക്ഷണങ്ങളെല്ലാം കൂടി ഒത്തുചേരുമ്പോഴാണ് നമുക്ക് അവിടെ ഈ പറഞ്ഞ ചാന്ദിപുര വൈറസിനെ കുറിച്ച് വരച്ച് എന്തുകൊണ്ടാണ് ഇതിന് ഇങ്ങനെ ഒരു പേര് വന്നെന്ന് ചോദിച്ചാൽ 1995 ഇങ്ങനെ 1965 ഇങ്ങനെ ഒരു രോഗം മഹാരാഷ്ട്രയിലെ നാഗ്പൂരിൽ ഒരു വില്ലേജിൽ ഉണ്ടായത്. ആ ഒരു ഗ്രാമത്തിലാണ് ഇത് ഉണ്ടായത്. ആ ഗ്രാമത്തിലുണ്ടായ ആദ്യ പനിയാണ്. ഈ പനിയിൽ ഈ മനസ്സിലാക്കി വന്നപ്പോൾ ഈ ഒരു രോഗാണുവാണ് ഉണ്ടാക്കുന്നത് മനസ്സിലായതുകൊണ്ട് ഈ വൈറസിന് ഇങ്ങനൊരു പേരിട്ട്. സാധാരണ നമുക്കറിയാവുന്ന പേരുകൾ എല്ലാം വെസ്റ്റേൺ നയൻസിലുള്ള വിദേശ രാജ്യങ്ങളിലുള്ള പേരുകളോട് ചേർന്ന പനികളുടെ പേരാണ്. പക്ഷെ ഇതിന് ചാന്ദിപുര വൈറസ് എന്ന് പറഞ്ഞാൽ ഇന്ത്യയിൽ ആദ്യമായിട്ട് മനസ്സിലാക്കിയിട്ട് അന്ന് 1965 തന്നെ റിപ്പോർട്ട് ചെയ്ത കേസാണ്. അന്നാണ് ഇത് ആദ്യമായിട്ട് ഡിറ്റക്ട് ചെയ്യുന്നത്. പിന്നെ അതുപോലെ 2016 ഇത് മഹാരാഷ്ട്രയിൽ വന്നിട്ടുണ്ട്, മധ്യപ്രദേശിൽ വന്നിട്ടുണ്ട്. അങ്ങനെ അവിടെ എല്ലാം വന്ന് ഇതിങ്ങനെ ചെറിയ രീതിയിലൊക്കെയാണ് വന്നത്. ഇപ്പൊ തന്നെ അത് ഗുജറാത്തിലാണ് വന്നിരിക്കുന്നത്. അപ്പം ഇത് ഭാവിയിൽ മറ്റു സ്ഥലങ്ങളിൽ വരാം. പക്ഷെ ഇതൊരു ഒരിക്കലും കേരളം മൊത്തമോ അല്ലെ ഇന്ത്യ മൊത്തമോ എന്ന് പറയുന്ന രീതിയിൽ അങ്ങനെ ഒരു വലിയൊരു ഭീകരനായിട്ട് പോയിട്ടില്ല. എന്നിരുന്നാലും ഇപ്പൊ ഗുജറാത്ത് ഗവൺമെന്റ് ഇതിനെക്കുറിച്ച് ആധികാരികമായിട്ട് പഠിക്കാനും അതിനെക്കുറിച്ച് കൺട്രോൾ ചെയ്യുന്നതിന് ഭാഗമായിട്ട് അവർ ഒത്തിരി കാര്യങ്ങൾ ചെയ്യുന്നുണ്ട്. അവിടെ കുറെ ടീമുകളെ തന്നെ 55ഓളം ടീമുകളെ വെച്ച് സ്റ്റഡികൾ നടത്തുന്നുണ്ട്. ഏകദേശം ഒരു 45,000 മുതൽ 55,000 പേരെ ഐസൊലേറ്റ് ചെയ്ത് അവർ നോക്കുന്നുണ്ട്. അതുപോലെ തന്നെ ഈ രോഗം വന്ന ആൾക്കാരെ ചികിത്സിക്കുന്നതിനായിട്ട് പ്രത്യേക ടീമുകളെ വെച്ചിട്ടുണ്ട്. പിന്നെ ഈ കേസുകൾ അനാലിസിസ് നടത്തുന്നതിനായിട്ട് പ്രത്യേക പഠനങ്ങൾ നടക്കുന്നുണ്ട്. അപ്പൊ എന്തുകൊണ്ടും ഈ രീതിയിലുള്ള കാര്യങ്ങളൊക്കെ അവർ ചെയ്യുന്നുണ്ട്. പിന്നെ നമുക്കറിയാം കൊതുകിന് ഒരു പരിധി വിട്ട് അപ്പുറം വരെ പോകാൻ പറ്റില്ല. പക്ഷെ അതുകൊണ്ട് തന്നെ നമുക്ക് നമ്മുടെ ചിക്കൻ ഗുനിയയാണ് ഓർമ്മ വരുന്നത്. ചിക്കൻ ഗുനിയ വന്നപ്പോഴത്തേക്ക് പക്ഷെ കൊതുകിന് ഇത്രയും ആൾക്കാരിൽ വരുത്താൻ പറ്റുമോ എന്ന് ചോദിച്ചാൽ സംശയം തോന്നുന്ന രീതിയിലായിപ്പോയി. അവസാനം മനുഷ്യരിൽ നിന്ന് മനുഷ്യരിലോട്ട് പകരുന്ന അവസ്ഥയിലോട്ട് വരെ ആ രോഗം എത്തിയെന്ന് വേണമെങ്കിൽ പറയാം. അപ്പൊ അങ്ങനെ ഒരു ട്രാൻസ്മിഷൻ വൈറൽ ഡിസീസിന് വരാവുന്നതാണ് മ്യൂട്ടേഷനിൽ. എന്തായാലും ഇത് കൂടുതലും എഫക്ട് ചെയ്യുന്നത് ഒരു 15 വയസ്സ് വരെയൊക്കെയുള്ള പ്രായമുള്ള കുട്ടികളായിട്ടാണ് കണ്ടുവരുന്നത്. മറ്റുള്ളവർക്ക് എന്തുകൊണ്ടോ അത്രയും ശക്തിയായിട്ട് വന്നതായിട്ട് കാണുന്നില്ല. അതുകൊണ്ട് തന്നെ ഇതിൽ പറയുന്നത് നമ്മള് കുട്ടികളെയൊക്കെ ഇപ്പൊ ഗുജറാത്ത് ഗവൺമെന്റ് ഒക്കെ പറഞ്ഞിരിക്കുന്നത് നിങ്ങൾ ഫുൾ കൈൻ ഷർട്ട് ഇടുക, ടിപ് ടോപ്പ് കുട്ടപ്പന്മാരായിട്ട് നടക്കുക, കൊതുകിനെ കടിപ്പിക്കാനുള്ള അവസരം കൊടുക്കാതിരിക്കുക, നമ്മുടെ ശരീരം മൊത്തത്തിൽ കവർ ചെയ്ത് നടക്കുക എന്നാണ് പറയുന്നത്. അപ്പൊ അതൊരു പരിധി വരെ ഒരു പ്രൊട്ടക്ഷന്റെ ഫസ്റ്റ് സ്റ്റേജ് ആണ്. അത് നമുക്കറിയാലോ, കോവിഡൊക്കെ വന്നപ്പോഴും എല്ലാവരും ഫുൾ ടൈം പ്രത്യേകതരം വേഷങ്ങളൊക്കെ കിട്ടി ആണ് പുറത്തിറങ്ങിയിരുന്നത്. അപ്പൊ എന്ന് പറഞ്ഞ പോലെ ഇതിനും അങ്ങനെയുള്ള ചില കാര്യങ്ങൾ. പക്ഷെ ഹോമിയോപ്പതിക്കാരായ നമുക്ക് എന്ത് ചെയ്യാൻ പറ്റും ഈ ഒരു അസുഖത്താൽ? പക്ഷെ നമ്മൾ ഒരിക്കലും ഭയപ്പെടേണ്ട കാര്യമില്ല. ഹോമിയോപ്പതിയുടെ കാഴ്ചപ്പാട് ഒരിക്കലും രോഗത്തെ എന്നുള്ള രീതിയിലല്ല, രോഗിയെ ചികിത്സിക്കുക എന്നുള്ളതാണ്. അപ്പൊ ഓരോ കേസിലും നമ്മളുടെ മുന്നിൽ വരുമ്പോൾ ഈ പറഞ്ഞ ഇന്റൻസിറ്റി ഇതെല്ലാം നമ്മുടെ മനസ്സിൽ ഓർമ്മയുണ്ടെങ്കിലും ഓരോ രോഗിക്കും വ്യത്യസ്തമായ രോഗലക്ഷണങ്ങളാവാം. ഇപ്പൊ ഒരാൾക്ക് ഛർദിലാകാം പ്രോമിനന്റ്, ഒരാൾക്ക് വയറിളക്കം ആകാം, ഒരാൾക്ക് ചിലപ്പം ഫീവർ തന്നെ കണ്ടിന്യൂ ചെയ്തുകൊണ്ടിരിക്കാം. പക്ഷെ അങ്ങനെ ഫീവർ തന്നെ കണ്ടിന്യൂ ചെയ്തുകൊണ്ടിരിക്കുക ഈ എലിമിനേഷനുള്ള കേസുകൾ നമുക്കെല്ലാം അറിയാം. വയറ്റിൽ നിന്ന് നല്ല രീതിയിൽ പോവുകയാണെങ്കിൽ തന്നെ ഒരുവിധം രോഗങ്ങളൊക്കെ വേഗം കുറയും. നേരെ മറിച്ച് പോയില്ലെങ്കിൽ പ്രശ്നമാണ്. പക്ഷെ അത് അധികരിക്കുമ്പോഴാണ് പ്രശ്നമാകുന്നത്. നല്ല പനിയുള്ളപ്പോൾ ടെമ്പറേച്ചർ ഇങ്ങനെ പെർസിസ്റ്റ് ചെയ്യും, ഛർദിക്കുകയോ വയറിളക്കുകയോ ചെയ്യാതിരിക്കുകയാണെങ്കിൽ ഒരുപക്ഷെ അത് പെട്ടെന്ന് ബ്രെയിൻ ഫാഗിലോട്ട് പോകാം, ബ്രെയിനെ അഫക്റ്റ് ചെയ്യാം. അപ്പൊ അതുകൊണ്ട് നമ്മളുടെ ഈ രോഗലക്ഷണങ്ങൾ ക്രോഡീകരിക്കുമ്പോൾ നമുക്കറിയാം പെട്ടെന്ന് കൂടുന്ന ഏത് മെഡിസിനും, ഈവൻ ബെല്ലഡോണ വരാം, എക്കണൈറ്റ് വരാം, പിന്നെ ആഴ്സനിക്ക് വരാം. പക്ഷെ ഏറ്റവും പ്രധാനമായിട്ട് നമ്മൾ ചിന്തിക്കുമ്പോൾ ഇതിൻ്റെ ഒരു കോളറയുടെ സിംറ്റംസ് പോലെ കാണിക്കുന്നുണ്ട്. അപ്പൊ കോളറയ്ക്ക് നമ്മൾ ഉപയോഗിക്കാവുന്ന മെഡിസിനുകളിലോട്ട് നമുക്ക് പോകാം. അതായത് കാംഫർ വരാം, ബെറട്രാൾബ് വരാം. അങ്ങനെയുള്ള കറക്റ്റ് സിംറ്റംസ് നോക്കി തന്നെ നമ്മൾ ട്രീറ്റ് ചെയ്യണം. അങ്ങനെ വരുമ്പോൾ നമുക്ക് ഒരിക്കലും ഇന്ന ഒരു മരുന്നാണ് ഇതിനെന്ന് പറയാൻ പറ്റില്ല. പക്ഷെ ഓരോ കേസും വ്യത്യസ്തമാണ്. നമ്മൾ എല്ലാ രോഗികൾക്കും എല്ലാ സിംറ്റംസും ഉണ്ടാകണമെന്നില്ല. അപ്പൊ അതുകൊണ്ട് തന്നെ നമ്മൾ പിന്നെ നമുക്കറിയാം ഈ പേപ്പട്ടി വിഷം പേപ്പട്ടിയുടെ ബാധ ഉണ്ടാക്കുന്ന അതേ ടൈപ്പ് വൈറസ് ആയതുകൊണ്ട് നമുക്ക് നമ്മുടെ ലൈസിനും ഹൈഡ്രോഫോബിനും ഇങ്ങനെയുള്ള മെഡിസിനെയൊക്കെ കുറിച്ചൊക്കെ ചിന്തിക്കാവുന്നതാണ്. അപ്പൊ എന്തുകൊണ്ടും ഈ ബ്രെയിനിനെ അഫക്റ്റ് ചെയ്യുന്ന മെഡിസിന് നമ്മൾ എപ്പോഴും ഒരു മുൻകരുതലായിട്ട് ഇങ്ങനെ വരുന്ന കേസുകളിൽ ഒരു ഡോസെങ്കിലും കൊടുക്കുന്നത് നന്നായിരിക്കും. കാരണം അതിന്റെ ബ്രെയിനിലോട്ടുള്ള ആ ഒരു പോക്കിനെ നമുക്ക് തടയേണ്ടതായിട്ടുണ്ട്. അത് ആ രീതിയിലൊക്കെ ചിന്തിച്ച് എല്ലാവരും കൈകാര്യം ചെയ്യുകയാണെങ്കിൽ ഇവിടെ ചാന്ദിപുര വൈറസ് വന്നാൽ നമുക്കതിനെ സുന്ദരമായിട്ട് ഹോമിയോപ്പതി മരുന്നുകൊണ്ട് ചികിത്സിച്ച് ഭേദമാക്കാൻ പറ്റും എന്നാണ് എനിക്ക് വേദിയോട് എല്ലാവരോടും പറയാനുള്ളത്. തീർച്ചയായും ഇനി മറ്റുള്ളവർക്ക് സംസാരിക്കാനുള്ള അവസരമാണ്. ഓരോരുത്തരായി ഹാൻഡ് റൈസ് ചെയ്ത് സംസാരിക്കാം. നിങ്ങൾക്ക് അഭിപ്രായങ്ങൾ പറയാം. മറിയാമ്മ ഡോക്ടർ ഉണ്ടല്ലോ അല്ലേ? മറിയാമ്മ ഡോക്ടർ ഒന്ന് ഹാൻഡ് റൈസ് ചെയ്ത്